We've talked about Xolair and we've talked about Nucala, and both of them have been approved for multiple conditions. I'm curious as to how we figure that out because Xolair was approved and then only 10 years later was it approved for the next condition. So what is it that indicates that you can approve it for multiple things?
Great question, Kortney. This is one of the reasons I love medicine so much. Biologic medications help us understand diseases better, for sure. We've learned one part of the immune system might not work for everyone, but sometimes the same medicine can help with different diseases. And we often figure this out when real patients are given the medication and we see that it's helping with other diseases. The issue is, though, that it takes a long time to get a medicine approved for something new because it has to go through rigorous clinical trials and you have to study it carefully to make sure that it works for that specific condition. But it's just basically trial and error and starting a patient on a medication and seeing how it works in that patient, especially a patient that has multiple atopic diseases or allergic diseases.
Yeah, so it's really paying attention to our patients and realizing that a medication that we started for X condition is actually now helping for their other condition. And that's what we realize over many, many years is that we really need to pay attention and see where else are we seeing improvements. And then if we see that across the board for multiple patients, that's when then a medication starts going into a trial and they start looking at it for other conditions.